two types of medication you will frequently have to administer are eye and ear medications. Watch the following procedure to learn how to administer eye medications.
After greeting the patient, verify her identity and check for allergies. Next, verify that you have the correct medication, the correct dose, and the correct route. Check with your physician to see if the patient should remove eye makeup.
When the doctor saw you, he asked me to put some eye drops in for that eye inflammation, so that's what I'm going to do. I'm going to put the eye drops in that Dr. Bengal asked. If you could just give me a minute, I'm going to set up, okay?
Okay.
All right.
Wash your hands and put on exam gloves. Check the expiration date of the medication. Remove the cap from the eye bottle and place the inner portion of the lid so that it is facing upward to prevent contamination. Position the patient by having her extend her head backwards so her eyes are looking up. To prevent touching the eye structure, hold the bottle 1/2 to 3/4 inch above the eyeball. Rest the base of your hand on the patient's forehead for stability. Place your other hand on her cheekbone and expose the lower conjunctival sac by pulling down on the patient's cheek. To do this, use tissue or 4x4 gauze. Be sure not to touch the patient's eye. Instruct the patient to look up and then drop the prescribed number of drops into the center of the conjunctival sac. Instruct the patient to gently close her eyes and move them to distribute the solution. Briefly place your fingers on either side of the client's nose to close the tear ducts and prevent the medication from draining out of the eye. If the eye medication is an ointment, gently separate the patient's eyelids with your thumb and finger and grasp the lower lid near the margin immediately below the lashes. Instruct the client to look up to reduce stimulation of the blink reflex. Apply the eye ointment along the inside edge of the entire lower eyelid, from the inner to the outer corner. To apply ointment to the upper lid, instruct the client to look down. Gently grasp the patient's lashes near the center of the upper lid with your thumb and index finger and draw the lid up and away from the eyeball. Squeeze the ointment along the entire length of the upper lid, starting at the inner corner. After administering the medication, remove your gloves and wash your hands. Finish the procedure by recording the time and route of administration on the medication record.
How you feeling, Mrs. Beam?
Pretty good,
Okay.
thanks.
Listen, the doctor will be here in just a little bit.
Okay.
Have a good day.
Thank you.